Hi, Kristen. I'm just going to go over your homework. Let's go ahead and look at number one. It looks like you did a nice job. You just forgot your procedure codes. Okay, number three, you have the UTI, you have the B code. Everything looks good, the hypertension. Number five, you have the HIV first. You don't need the L code. You look at that. If you look in the exclude with that, you do not code it. So make sure I always look at the beginning of those categories. So with that, or you do not need that B code. Z5 3.1 is fine. Okay, so let's move on to chapter 3. Okay, chapter 3, it looks like you started off here, you're close to your codes. The biggest code that you did miss was the principal diagnosis. Here you just want to go under the main term mass, and this will direct you to the organ. So adrenal is where you want to go to for that one. So in the hypertension code, let's not stay away from those symptom codes when they're related to what's going on. So with that, let's go ahead and move to number 3. You have the correct diabetes code, so that's great. UTI, you have the B code, and we also have some activity codes for number 3. So go ahead and make sure you read through here, but like I said, you're right on dot for that. Okay, number 5. With this, I guess I need to look at that. You have down HIV. One thing to remember, if the patient didn't come in with the HIV, so with that one, you do not want to code HIV. They actually came in because of the diabetes, right? And they had the heart failure. They also had the UTI, and then we have the K pneumonia, which, yes, this usually is a symptom of HIV, but once again, make sure you do not code it in this type of scenario as principal diagnosis. Number 7, you are close. You are missing some digits, just have them in the wrong area. This is an underdosing situation, so make sure we need a T code for underdosing of insulin and patient's intentional underdosing. All right, so let's go ahead, and here I have number 9, which I don't see that you have. Or type 2 diabetes. Okay, let's go through number 10. Okay, so this first one here, we want open wound is first, and that is going to lead to the cellulitis. So I'm not sure, I think this H code is your cellulitis, which yes, we do need. We have 2 cellulitis. Keep that in mind, but we do need the open wound sequence as principal based on the circumstance of the admission. And then we have the debridement, and it looks like you did a good job on those. Number 2, looks like you did a nice job. Again, keep in mind these are all in the announcements. You are for number 2 missing a procedure code, the destruction. Let's go to number 3. Looks like you did good with the pressure ulcer. Cancer code, off with a different 5th digit. And you want to do the excision and transfer of the back for the skin, which you don't have. Okay, let's get number 4. Looks like you did a good job on that. Number 5, everything looks good. 6, we don't need the scratch code, and I had this with a couple other students because it progressed to cellulitis. So you just code the cellulitis. Number 7, go ahead and check that one. You have the UTI right, in E. coli right. We need adverse effect of penicillin for number 7. So just kind of make sure you look at that one. Number 8 looks pretty good. We're missing the MRSA. And Number 9, we have local lupus. So you're right on track. So make sure you review these. If you have any questions,